Good evening, everybody out there. We meet again. From the last show, I have got few phone calls requesting what is the difference between spiritually induced schizophrenia and chemically imbalanced induced schizophrenia. A lot of people think that they might have this, or one of the relatives have this or have that, and they want just an explanation. So I promise today we're going to touch up on how we differentiate, for the simple public out there, how to differentiate between spiritually induced madness and chemically imbalanced induced madness. They are totally different. If you out there and you suspect one of your friends or relatives or loved ones have schizophrenia and you want to know which one is which, simply ask them to produce 12 angles shape. I usually put 6 angles in one shape, next to it or overlapping another 6 angle shape. I don't have the drawing now, I will draw it for you. But most of the chemically imbalanced induced schizophrenia, they cannot reproduce that. They have a difficulty of making 6 angle shape. They can make 4, they can make 3 angles, but they can never make the 12 angle shape. You know, so we make 2 hex angle. Hex means 6 angle shape. They can never reproduce 6 angle shape. They cannot. This one is very much, most likely, is chemically imbalanced induced schizophrenia. The spiritually induced one, they can produce it. There's no problem. There's no problem. Now, let me explain to you. I know, you know, we are doctors. We follow evidence-based medicine. When we're talking about spiritually induced, there is no evidence-based there. It's just like you getting Wi-Fi, you making phone calls through WhatsApp, through Wi-Fi, but you do not see the Wi-Fi. It's very much the same thing. You don't see it. Only those with experience, with patients, that can tell us more. Somebody like me, I've been seeing a lot of these cases. I can tell you that there is spiritually induced schizophrenia. Now, let me just give you a small explanation and clarification. When God created us, He made a spectrum of vision and a spectrum of hearing. And human can only get 5% of that spectrum. We can only allow to see 5% of everything out there. We can only allow to see 5%. Other entities, animals, for example, some animals, they can see infrared, suprared, ultraviolet. So other entities that God has created, they have the ability to see more than us. We only allowed that 5%. That is the general rule. Every rule has an exception. Those with schizophrenia, they have got extra, more than the 5% that every normal people out there can have. Those I'm talking about, the spiritually induced schizophrenia, they can see more. What had happened? That they are seeing more than us. And they are hearing, by the same token, hearing also is a spectrum. We only have 5% of that spectrum that allows to see what we see now and allows to hear what we hear now. We do not see suprared, that's another wave. We do not see infrared. We do not see ultraviolet. We don't have the capacity. God has not given us this capacity to see. Other entities have those capacities to see. Those with spiritually induced disorder, they have the capacity to see more than 5%, that 5% that only human can see. And they have the capacity to hear more than that 5% that God allows us to hear. So they have the extra dose of hearing, the extra dose of seeing. That's why they see what we don't see and they hear what we don't hear. Now, there are other signs and symptoms that also can tell us that this is a spiritually induced disorder. Like what? Dreams, very crucial. You dream about scary things, dogs, snakes, dead people, falling from a high space, falling into rivers, seeing yourself in very unhygienic places all the times. Even sexual intercourse, vivid sexual dreams. This can all, if it's combined with patient seeing things and hearing things that you and I do not hear and see, this can give us more reason to believe that this might be spiritually induced schizophrenia. Now you're going to tell me, what are they saying? In the last session, we have given a video, we explored, it's, by the way, it's on YouTube. If you go to YouTube, you will find it. Under My Media TV, you will find it there. Also on my page on Facebook, Dr. Soliman Clinics and Labs, you will see it there. If you want to get a refreshment and see what they see scary faces. It happened that this disease happened to somebody that has the ability to draw and reproduce what he sees, and he showed us and told us what they see. Also, the internet is full of, cases and simulation and patients talking about their own experience, what they see and what they hear. But now the target now is to explain, how do you know this one is spiritually induced, and how do you know this one is chemically imbalanced induced? And that is the difference between the two. The most important difference is the 12 angles. They cannot reproduce the 12 angles. Those are the chemically imbalanced induced. The spiritually induced, we have signs and symptoms, that they see. Most of those spiritually induced, they see the visual hallucination, what we call it in medicine, visual hallucination. They see what we do not see. The next question would be, what are they seeing? Like I said, with that video, the guy drawing scary faces, this is what he see. Some others do not see clear faces. They see something else. They see shadows. Shadows. Yes, shadows. Especially at the corner of their eyes. They see shadows. They feel as if somebody is sleeping with them at night in the same bed. They feel like somebody with them all the times. Some of them do not see shadows, but they see dots, red dots, blue dots, red dots, black dots, sometimes white shiny dots. Those are the things they can see. With time, they will see more clear and you will hear more clear. I'm talking about they will hear the other entities that is, causing this spiritually induced disorder with them, especially schizophrenia. Now, the next question would be, can spiritually induced schizophrenia cause chemical changes in your body? Absolutely yes. That's why we have to combine medicine with the therapy, the spiritually psychotherapy that we do for those patients to get rid of those entities. Yes. The same with epilepsy. Some epilepsies are induced by spiritual causes. You do an EEG is normal. You do an MRI, the brain is normal, and yet you have epilepsy. So this is also another manifestation of spiritually induced disorder. I'm not saying everything out there is spiritually induced, but we must differentiate between the two. We are doctors. We are trained for Western medicine. This is where we get our medicine from, because they are all textbook, all reference book, everything is Western medicine. We have not, nobody can touch up on the spirituality. This is something you gain during your experience. And those are things that are documented by video, and there are some research and studies on them to prove exactly what I have just said. I'm not imposing my beliefs on you. You don't have to believe if you don't want to, but this is the cases that I have encountered, video documented, and there are studies saying the same thing I'm saying. I'm not making it up. Now, we know clearly now what is the difference between spiritually induced and chemically imbalanced induced. And we see, we said chemically imbalanced induced, a patient that is mostly hear things that you and I do not hear. Spiritually induced, they hear and they see. And we explained to you the spectrum that God created us with. We cannot see infrared, we cannot see ultraviolet. Other entities, they can see ultraviolet, they can see infrared. Those people who are spiritually affected, they can see beyond the infrared, beyond the ultraviolet. They can see. So they can see the other entities that God has created out there that you and I cannot see. And does it bother them? Yes, because those things are not friendly. So it's not like, oh my God, this is nice, I want a friend. No, they're not friends. They are out there to hurt you. So how did I get them? What made them come to me and induce all these disorders and all this harm to me? Well, they don't come by themselves. When God created human, He shield human. That's why even the newborn is shielded. He cannot get affected by those entities. So religion has to do a lot with it. Being close to God has a lot to do with it. So those entities come in two cases only. Either you invite them yourself, or somebody send them to you. What we call witchcraft, and it's very common in Africa. Right? So somebody send them to you, or you invite them yourself. That is the only two conditions you can get affected. If you have a strong spirit and you are very close to God, less likely you're going to get this kind of spiritually induced disorder. Less likely. But can it happen? Yes. It can happen. Even if you're very close to God, Right? It can happen. Now, what is the treatment? We have to do a special kind of treatment. We call it spiritual psychotherapy. All right. I think we have covered the schizophrenia. There are other spiritually induced disorders we will touch upon, but let's now leave mental disease aside and we'll go into medical diseases, okay? Please, if I can see video number 1 and we touch upon this case and we can understand together what we can. What is the complaint?
I have breath cyst. It comes and goes at times 3 times a day.
So you cease breathing?
Yes.
And then the heart rate goes up. You feel like the heart is pounding?
Yes.
And this has been going on since how long?
Since a year now.
And you dream about what?
About having sex.
And
also seeing dead people.
Yes, I understand. All right.
You heard the man is a young man. Does it happen to women? More likely to women. I chosen the patient to be a man because less likely it's a man, more likely it's a woman. So what is going on with this patient? He just said that his breathing ceased 3 times in a day, and yet he's right there in front of me alive. So what is going on? If your breath ceases 3 times in a day, 365 days in a year, because he has it for a year. That means, you can do the math now, it's about 1,000 times his breath has ceased on him. And he's still alive. He's breathing, he's there, he's strong. But, so is he making up the story? Why would he come to the clinic then if he's making up the story? Does he need attention? I don't think so. This is something that has been bothering him. He's been a lot of different health facilities. And no satisfaction, no, because they just didn't understand what is going on. Maybe he never gone to a specialist. If he would have gone to a specialist, the story might be different. He wouldn't be seeing me after 1 year. So what is going on? Let's understand the case together. This guy, his breath ceases. But does his breath really cease? No. It feels like, now I'm talking about the explanation. It feels like his breath is ceasing on him 3 times in a day for the last year. I asked him, do you feel your heart bounding? Yes. Bounding meaning palpitation. The heart is beating so fast. As the heart is going to jump out of the chest. That's how they feel. That's how most of them describe when they get the attack, palpitation. Well, I tell you, this is not a medical condition. I mean, I'm talking about physical medical condition. It is not. It is physical manifestation, but not because of cardiological problem, because of a heart problem. Because we, in case we get a patient like that, yeah, more likely it's a psychiatric disorder. We call it panic attack. It's a form of anxiety, severe anxiety that manifests in the form of panic. Panic means fear, extreme fear attack, panic attack. So what is going on with this guy? We cannot just, believe him that the heart doesn't have a problem, because we've seen young people before with a heart problem causing the arrhythmia. We call it arrhythmia. When the heart beats more than usual, we call it arrhythmia. So we have to do the cardiology evaluation, the heart evaluation. So we have an ultrasound in the office. We put the ultrasound, we look at the heart. There is no arrhythmia. The atrium, which is the upper room of the heart, beats in sequence with, in synergy with the lower room, which is the ventricle. So there is no problem. So that means, because if he has a physical condition, then this physical condition will be on all the times. It's not like now I have a cardiology problem and then after 2 hours the cardiology problem goes. If there is arrhythmia, the arrhythmia is there day and night. When you wake, when you sleep, it's 24 hours. The cardiology problem is there. They don't go and come back. It doesn't work like that. So that means that the correct diagnosis for this man and for anybody out there with similar problems is called panic attack, which is a form of anxiety. Treatment, some medication, SSRI, serotonin, selective serotonin reuptake inhibitors, and the doctor will decide that. You cannot decide that on your own, because the doctor has to decide on the dose and has to decide also on how many days you should be taking the medication. Plus, there is therapy, special therapy for that, and the patient will be fine. Right? So we must evaluate the heart to rule out any arrhythmia or any serious heart problem, and we continue. The most likely diagnosis in this case is panic attacks. So in summary, if you feel like this man said, your breath is seizing on you a few times in a day, you feel like your heart is gonna jump out of your chest, very bad palpitation, you feel like I'm gonna die. This is most of them how to describe the situation. I feel like I'm gonna die. I feel difficulty in breathing. I feel, you understand? And those are bad moments. Those are not to be taken lightly, because really it's horrifying. Those moments of panic attack, some of you out there who have this disorder, do you know exactly what I'm talking about? And I know exactly how you feel. Okay? This is like I said, if a dog run after you, wants to bite you, and you're right, you see, you run for your life. Take that fear that you have inside of you, multiply by 1,000 times, and this is exactly how those patients feel. Would you want to feel like that? It's very terrifying. It's very bad. So this is what we call panic attacks. Panic attacks. And panic attacks, they have a solution, they have a therapy. Most importantly, we have to understand, that this is a situation that has a solution. I am taking calls, but I think I put the phone a bit on silent, so I think I missed this call. But anyhow, if you hear me, my phone number is there. If you have a question, I will try to put the phone in front of me, so if I can take some calls if you have a question out there. So we have discussed panic attacks. It's a form of anxiety, and we have discussed how the patient feels. And if you have someone, if you are yourself feeling the same way, so please, this is what you have, panic attacks. You should check yourself into the nearest specialist to get the heart evaluated correct and rule out any serious problem with the heart. Then if it's not the heart problem, is no arrhythmia, is no heart rate that is because of pathological reasons, then most likely it is a panic attack, and that's exactly how they come in, and this is exactly how they describe themselves. Now, I said the last time that it's very important to recognize the early signs and symptoms of any disease to get a better prognosis, to get a favorable prognosis, to get a favorable outcome so you can recover faster. So early recognition of a disease is crucial for early prognosis and early recovery, right? I'm going to show you now another case. Let's see it together and then we'll talk about it. Let's see the next video, please.
Mama, what is your complaint?
My stomach is large,
Mm.
and this place I'm feeling pains here.
Yeah, biting pains here.
Biting pains here on top of my navel.
Right.
And I was operated there.
Yeah.
This Nsungkikang and
It doesn't matter. Okay,
Yes.
When was the operation?
Last year, 2001, June.
Okay, no problem, no problem. And you said 2 of your kids are hepatitis B positive?
Yes.
Okay, Mama. So, and you never tested hepatitis yourself before?
No.
All right, so now we're gonna do an ultrasound to see what is there, okay? All right, now, looking at the ultrasound here, this is one side of the liver, okay? This obviously, this is hepatomegaly for sure, but if we look closer into the liver, we see nodules all over the place. This is the left side of the liver, nodular. This is the IVC, if we put some colors, if you wanna see the colors. This is the IVC right there, and this is the right atrium, the one that is beating in front of you. So now we're gonna move on. We can see a lot of nodules here. We see the liver all big, all the sinusoids are all enlarged. And now this is the right kidney here. The right kidney looks okay to me. But when we look closer to the liver, we see nodules. We see nodules.
Yeah. Let me talk about it. Play the next one also. Play the next video so we can look at the spleen as well, and then we'll summarize the whole case and we'll talk about it. This, please, if you don't mind, I appreciate it if you can play the next video as well, please.
We're looking at the heart for the same patient. The heart is okay. There is no pericardial effusion around. There's no pericardial effusion. The left ventricle function, just by looking at it, we don't have a problem. We're looking at the different valves. I don't see a problem here. We don't need to take any measurement, just from experience. The way the heart is beating, I can say the ejection fraction is within normal, and the left ventricular function is within normal. We don't need to waste time on that. But look at this here. Look, the abdomen is full. This is nodules all over the liver. The liver is huge. It's filling up the stomach. And the bites, we can understand now where the bites are coming from. This is over distension. It's not because of adhesion, because of the previous surgery, that's for sure. But this is a metastatic cancer. Okay, if we look at the gallbladder here, the gallbladder, we see a small stone, but this is irrelevant. This is not the problem. You see the small stone inside the gallbladder. This is irrelevant. This is all nodular liver, huge nodular liver, most likely metastatic cancer. Next step for this patient, to define the primary, we send her for CT scan.
All right. Well, there is another one, but it's okay. We're not going to play it. It's okay. We also looked at the spleen, and the spleen is full of nodules, and that was the key. That we know when the situation like this is, unfortunately, after I told the patient, listen, we send you for CT scan because we know this is most likely it's cancer, and we know what kind of cancer it is, but we need to see CT scan to look for the primary. Primary meaning where it has originated from, the mass. But, oh, doctor, I made a CT scan. When did you make a CT scan? Oh, back in January. Oh, wonderful. Why you didn't tell me from the beginning? Oh, maybe she was testing me. Anyhow, so what I told her is exactly what the CT scan have said. It is cancer. And it is lymphoma. Okay, lymphoma of two kinds. There is Hodgkin, there is non-Hodgkin. What she has is a classical Hodgkin lymphoma, which is a good kind. The other one is very aggressive. You don't want to have it. But why I'm giving you this case today? I mean, this is a case because I want to tell you this could have been all prevented easily if the patient have just listened to a second opinion. Why I'm saying that? How could it be just prevented? A case like that? Come on. Yes, it could be easily prevented. When I took the history from this patient, she told me the following, that she was sick and tired for years from internal heat, night sweats, and a bit of loss of weight. Three things. Internal heat. Those people from, they're not very highly educated, and they tell you in their language that, in common street language, that internal heat and fever. And I'm losing that, I'm thinking I'm losing a bit of weight. That definitely, out here in Cameroon and Africa, malaria, typhoid, malaria, that's what it is. So she went, malaria, typhoid, malaria, she doesn't get well. She take the treatment, she eat the medicine, she doesn't get well. The same thing, the internal heat, the high fever, above 38, and a bit of weight loss. She doesn't get well. So this is what we call now unexplained fever, weight loss, and night sweats. This is what we call those three things. Unexplained, meaning malaria did not explain it because she took the treatment for the malaria and she still gets it. She took the treatment for typhoid and she still gets it. That's what we call what? Unexplained. So if you have unexplained heat, or what you call fever, and night sweats, you feel cold, you feel hot, and you take the treatment and you don't get well, that maybe you should be thinking it has to be something else now, right? It has to be something else. So now is the time to go to a doctor and explain to them, doctor, I have this, and this, and I'm taking malaria typhoid treatment for the last few years and I'm not getting well. So doctor, what do you think? Then the doctor will tell you, this is something that we have to look into. Definitely is not malaria typhoid. That is something else bigger. Some facilities, health facilities out there, they told her, okay, well, we're going to do tuberculosis test, skin test. Well, the skin test is going to be positive, obviously, because everybody in Africa, including me as an Egyptian, who took the BCG vaccination, which will show positive in the skin test. So she doesn't have TB. Oh, let me be 100% more sure. I'm going to send you for X-ray. So I send the patient, or whoever, it's not me, whoever, send the patient to an X-ray, and the X-ray shows some nodules, some nodes, lymphoadenopathy, hilar lymphoadenopathy here at the middle, at the level of the mediastinum, here in the middle of the chest. Oh, that's definitely then tuberculosis. And she swallowed medicine for 9 months for tuberculosis. And guess what? It wasn't tuberculosis. This patient, if you listen to her history very well, you wouldn't diagnose her with tuberculosis. She has cervical nodes on the side of her neck that are firm, mean hard, and painless. It doesn't pain. And that is lymphoma. That is lymphoma. So now, she went for hernia because she said around her umbilicus was biting. So she went and did surgery a couple of years ago, thinking because of this hernia, the biting is there. She did the surgery. Years after the surgery, the same place is biting. So it was never the hernia causing the biting. It was something else. When those patients with the lymphoma get the lymphoma, there is a lot of lymph nodes here around the umbilicus. They get bigger. They stretch the surrounding. She feels the biting. So it's because of what? The lymphoma. So if you put one and one together, we have the cervical lymph nodes that you see around the neck, coming like this, projecting out of your neck like that, and they are hard, and you push them, it doesn't pain. And you have the night fever, and you have the night sweats, and you have the weight loss. Come on now. This is something else. If she would have been diagnosed early, that is, prompt recognition of the disease, she could have been still at stage 1, stage 2. Meaning early in the disease. Let me not confuse you. What should have been done for this patient? When whoever diagnosed her with tuberculosis, it could have been much better to take one of those nodes out, send it to the lab, and get a staging on her, but that's definitely lymphoma. And if she was at stage 1, stage 2, meaning early, still early in the disease, we have a much better chance for this patient to recover and go back to normal and the disease to disappear. Now the disease at a late stage. Nothing is impossible for God, but it's now stage 3, 4. Okay, so we have not staged the disease because we have not sent for biopsy yet. But what we can see and the CT scan show us, it's all over the abdomen already. So right now we only can do supportive because the patient refused chemo and radiation, because that is the ultimate treatment for her, chemo and radiation, and chemo and radiation. But she refused, and that's one thing out there to let you know and to tell you that please. When you feel that you still have the symptoms that you came in for and have not been resolved with the medication you were giving, it is time to seek a second and a third opinion. Because after all, it is your life, right? It is your life. So what I'm trying to say, if you feel something, please see the doctor. If you do not like what the doctor says, or you do not get resolved with the doctor medication, see another doctor to get satisfaction and to get cured. It's all for you. My advice to you tonight, when you feel something, don't take it lightly, especially if it's something of that magnitude. Okay? I hope you get the lesson, and I hope you understood me very well. When it comes, even with the mental cases, with the spiritual cases, the earlier we recognize the disease and we diagnose. Diagnose meaning we know what you have. The rest is easy now. If I know what you have, the rest is very easy, right? So, yeah. Let's move to the next image, or another sad story that I want to share with you. Let's move to the next case. Yeah. Just hold this picture for a second. Let me talk about it. Believe it or not, that this is a woman. And believe it or not, I'm going to tell you the age and you'll be shocked. She is 35 years old, a mother of 3, married 2 years ago. Actually, 2018, make it 3.5 years ago. 3.5 years ago, this woman was a beautiful woman, healthy, big, strong, weights above 90. She's almost 6.5 feet tall, or 185 or so. Now she is in diapers. She has no control of her urination, her defecation. And I want you to look at the skin. The key is in the skin. Look how the skin looks. Please, the next image. This is now the spots that you see in the skin. You can now see the leg. The leg is, see the epidermal, which is the superficial layer of the skin, is burned, is black, is necrolysis, is all bad. How did the disease start? This is actually, in my last 7 years of practice, this is number 4 case, the same thing. 3 of them, they already fine. This one, she came after 3 years. She started in 2018, and I've seen her very recent. What is going on here? Let me see the eye. Let me see the next image. Look at her eye. That's it. Now, you can remove these images because maybe they're horrifying for some people. Maybe they not look good for some people. You can remove the images and let me speak now. So, what happened to this lady? This disease is called Stevens-Johnson syndrome /TEN. What is that? The epidermis TEN stands for toxic, meaning there is bacteria that produce toxins that causes the skin to be necrolysis and sloughing off. Toxic epidermal necrolysis, Stevens-Johnson syndrome. Let me tell you, I had a patient in 2015, 2016. Her daughter came to me and she said, I see the skin is sloughing off my mom. Skin is sloughing off all over her body. Oh, when this happened? Yesterday. Oh, wonderful, great. Few medication, finish, and the lady is done. And that's, see what I said? The skin is sloughing off, peeling off. The skin is peeling off on her body. What can I do, doc? Nothing. Just give her this medication, a small tablet, a couple of thousand, it's finished. And she's fine. See how the disease starts? Skin is sloughing off. Okay, skin is sloughing off. Okay, I'm getting the termination notice for 5 more minutes. Okay, so skin is sloughing off. Listen to me very carefully. Skin is sloughing off, that is the early sign. So when your skin is sloughing off all over your body, that's a very bad sign. You should already contact the doctor because that's the beginning of catastrophe. Like this lady. In the first 4 days of diagnosis, we give you the medication, you recover, nothing happened, you go home. These cases, I looked for the ultrasound that I made, but I couldn't see it. It was a little bit in a rush for this session. So the disease starts with the sloughing off of the skin. And then that sloughing off progress to burns, like you seen in the foot, and now necrosis on that foot that now requires surgical intervention to remove and to debris and to get rid of all those bad tissues and clean her up and put her in intensive antibiotics, IV, and to... Now you looked at the eye. What is the eye? That's a melting cornea. The same way her skin was sloughing off and her leg was necrolizing like this is the same thing that is happening to the eye. The eye is sloughing off, the membrane of the cornea is sloughing off and causes necrosis under and close. That's a very bad infection. Anyway, when she came in, she couldn't see. We put her in intensive eye drops, antibiotic and systemic antibiotics. She was improved. But after what? You know, one of the most serious complications of this disease is pleural effusion and pericardial effusion. Of course, we send her for CT scan because I want to see what is there. So they came up with the same thing. They didn't see a solid mass because there is no solid mass. The disease is cancer of the hematology, of the hematological cancer, meaning cancer of the blood. That Stevens-Johnson syndrome somehow causes malignancy, and this malignancy causes the pleural effusion. Pleural effusion meaning fluid around the lung, and this fluid most likely is pus. Pericardial effusion meaning fluid around the heart, and this fluid most likely is pus. So we know that. Sadly, the lady died. So what I'm saying, prompt recognition is very crucial for early diagnosis and early management, and you go home safe. Thank you very much for listening. God bless you out there.